Thank you for all being here for my first State of the College address. I hope this is an informative part of the discussions that we're going to have about the future of the College of Public Health at The Ohio State University. As the faculty members who are in the room know, one of the things that I've been doing to get to know each of you better and to frame a picture of the college as a whole is to ask two questions. What do you care about? And how did you get there? Let me start by sharing my answer, which explains the opening song, Faith by Stevie Wonder, featuring Ariana Grande. When I teach, I always open and close with music. Each piece, however different, is a way for me to underscore the core point I'm always making about my definition of public health. It's an argument. It's an argument about what we owe to and sometimes must do to each other in the name of our common well-being. Many good, important songs, like good arguments, speak to social and economic relations and politics. As a teacher, I also use music to instill a sense of joy in learning, but above all, I use music as a way to open up discussion, even in a classroom with 400 students in it. Starting with a little music is sometimes less intimidating than starting with John Stuart Mill. What's the song saying? What's the argument it's making? Why might that matter? How can it help us understand this moment in time? But while I do care about music and arguments, most fundamentally, I care about students finding and being comfortable with their individual voices. Growing up, I felt like I had my distinctive voice, but something sometimes happens to girls and women in particular, and our confidence in our voice can falter. My voice faltered when I went to Columbia University as a graduate student. You probably can't hear it now, but I sounded like I was from Texas, which had the power to trigger any number of assumptions, not only in other people, but also in myself for the first time. And whether I was in a classroom with 15 PhD students in history who seemed to have known from the beginning of time that they were going to be world-renowned historians and win the Bancroft Prize and all of that, or in a lecture hall with 200 epidemiologists who cared very deeply about methods, I felt like I was always on the verge of saying something either pedestrian or painfully obvious. And it wasn't until I was a few years into my faculty career that I came to trust my own voice again. And so my teaching career has been about finding ways to ease that journey for my students, to illustrate for them the value of developing their own voices through critical dialogue, to using those voices in the classroom to enrich the academic experience, and to improve their success as advocates for and with the communities that they serve. And of course, to challenge old ways of thinking in the interest of advancing our shared fate. And I'm really pleased, students wave, I'm really pleased to see some students here and some very recent alumni. I care that you're here, and I hope that sharing a little bit of my experience resonates with you as well. As dean, my vision centers on our collective college voice. As I've been asking what you care about, I've also been asking what we are saying and want to say as a college community. So this has allowed me to listen to our vision and mission statements with a new set of ears. So here's our formal mission statement. There's nothing here that I disagree with, but here's my problem. This could be any school of public health. It could be any health department. It could be any not-for-profit organization. I hear three things in the voice of the college that are key to reframing our mission and vision in a distinctive way. First, I hear in the voice of the college a deep understanding that as a society, we collectively create the conditions that unfairly hold some groups and communities back. We collectively create the conditions that hold people back. I can only highlight a couple of examples, but I hear that commitment in our opioid research. In one project involving Drs. Kathy Lancaster, Pam Salisbury, Abby Norris-Turner, Bill Miller, and students Trevor Moffett, Dan Brook, Angie Hetrick, and Hannah Pascalco, public health uniquely contributes to the understanding that it's not simply substance use and the need for medication for opioid use disorders that's pervasive in Appalachian counties, but stigma. Stigma impedes appropriate care. I also hear that commitment in Dr. Juliana Nemes' work on brain injury in women who've experienced domestic violence. She makes clear that brain injury is not simply a problem of soldiers and athletes, a problem of those who tend to be more visible in our society. Juliana works with women, with community groups, and practitioners to stress the importance of recognizing brain injury from both blunt force trauma and from oxygen deprivation due to strangulation. She works to find the best ways to support and treat survivors. I hear that commitment in the work of Dr. Shawnita Seeley-Jefferson, who leads the Social Epidemiology to Eliminate Disparities Lab, the SEED Lab. Shawnita's research recently called attention to the city of Detroit, which violated the Michigan Constitution and negatively impacted preterm births. The city overassessed property taxes for low-income homeowners, turning them into renters through tax foreclosures in one of the most racially segregated cities in the United States. And I hear that commitment in Dr. Myra Katz's efforts to reduce cancer disparities amongst minority underserved population, including recent work exploring strategies for mail-at-home HPV tests to women with poor access to healthcare. Identifying and addressing stigma, the social and economic conditions of women, and systematic structural exclusion of minority communities, those are all key to advancing public health, to advancing the common good. Second, in my ongoing conversations with faculty, staff, and students, I hear a passion for advocacy, for policies that change the rules of the game. And the one thing that impresses me more than anything is it's not concentrated in one division or one of our fabulous centers. It cuts across our divisions. It's part of the work of our centers. And our work exemplifies advocacy in a robust sense. One arm involves setting standards. Dr. Darrell Hood has identified environmental contaminants with direct negative impacts on learning and memory. Darrell's research has informed federal standards for studying these types of exposures. Dr. Michael Pinnell's work on advisory boards for the EPA and the National Academies of Sciences, Engineering, and Medicine has helped to determine national safety levels for chemical exposures. Our faculty are also engaged in policy-oriented evidence generation and stewardship. The Ohio Policy Evaluation Network, or OPEN, led here at Ohio State by Dr. Allison Norris, collaborates on innovative interdisciplinary research exploring topics including contraception, abortion, and infant mortality. Open stewards evidence to policymakers to enable them to support equitable, non-stigmatizing policies. The work of Drs. Amy Furkatich, Megan Roberts, and Liz Klein informed first the implementation of local Tobacco 21 policy and later its enforcement. And our faculty are also leading the policy conversation. Oops, I'm one ahead. Dr. Mary Ellen Wewers, who is also a member of the Columbus Board of Health, and Dr. Micah Berman work tirelessly at the local, state, and national levels in order to introduce evidence-based practices that resulted in raising the minimum age of tobacco purchase to 21, first in Ohio, and now that's the law of the land. Dr. Wendy Zhu is beginning to drive the public conversation about health coverage. Despite the Affordable Care Act's intentions, it's the economically advantaged, Wendy has found, who have benefited the most. It is also important to recognize that we can neither identify nor address the drivers of disease and disparities unless we connect to and empower communities, positioning them to lead us towards a healthier future. Dr. Taslim Padamsi's Daughter, Sister, Mother project has demonstrated systematic racial disparities that disadvantage African American women who have a higher than normal cancer risk. In partnership with OSU's Center for Cancer Health Equity and colleagues in the colleges of nursing and medicine, Taslim is building relationships through churches, community groups, sororities, so that the community can direct the relationship with OSU. They can drive that relationship. Whether it's through setting regulatory standards, serving as evidence brokers for policymakers, actively working to change policies, or empowering communities, The Ohio State University College of Public Health has a clear commitment to advancing our shared fate through different forms of engagement in the democratic process. And that's what I see in this. These are different ways to participate in democracy. Any school of public health that wants to lead must occupy this space. And I want to take this moment to thank our community partners, including those at the Ohio Department of Health, Columbus Public Health, Franklin County Public Health, for joining us here today. You share our commitment to working with communities, to engaging them and empowering them, and I really appreciate that you're here with us. Finally, in my ongoing conversations here, I hear a deep belief in the power of connecting to the broader university in order to advance critical thinking. And I think probably the thing I've heard a lot from faculty members as I've asked what you care about, a significant number of people started with, I care about teaching. So I would call out, in fact, Jen Hefner on this front. That was the first thing she said. And she has been, that was one of the first things she said. And also Rebecca Andridge. I don't know if Rebecca is here today, but those were big themes that emerged from my discussions with them. So there's a line from the poet John Keats that I like to use to define critical thinking. In a letter to his brothers, he describes the importance of grappling with uncertainties, mysteries, and doubts. It's the communion and conflict. The conflict is important amongst different perspectives, different ways of knowing, through interdisciplinary teaching that creates the rich learning conditions that allow students to engage with one another, to really engage with one another. We want our students not just to be able to know things and do things. We want them to change their understandings of self by confronting some challenges. We want them to forge their values and commitments through sustained discussion, disagreement, deliberation, and collaboration. And then we want them to act on those values and commitments as professionals. One of the things that sets us apart is our integrated approach to both graduate and undergraduate education, serving as champions of critical thinking in the classroom. That commitment is evident in the architecture of our programs. And there's a lot going on here, but the point I want to make is that the sheer number of academic connections we make sets this college apart from its peers nationally. And I'd like to thank this moment to thank the leaders from throughout the university, you know who you are, who make these meaningful collaborations possible and who are eager to seek out more opportunities to work together. Thank you very much for coming. And I'd like, of course, to call out Dr. Mike Bassesi, who is the mastermind behind our academic architecture here. Our joint program, I'm just going to highlight one, with veterinary medicine provides an excellent example of the power of connections at the graduate level. The umbrella of One Health requires that we think about the interactions between animal herds and the human herd and the predictable consequences, like a novel coronavirus outbreak. We do that better when we have public health students in the same classroom thinking with animal health students. We want these students to think together. Another standout example of our connectivity is the structure of our undergraduate degree, which is not just a public health degree, as you'd find in many places, but it's a joint program in sociology. And this, I'm going to argue, is going to be more important as we move forward. What's going to happen with the general education curriculum is that it's going to shrink from 58 credits to maybe 32 to 39 credits. As that happens, That makes that box with the sociology courses all the more important. So imagine if we replicated this for history, anthropology, psychology, just to name a few disciplines. If we had a rich mix of disciplines in our public health classrooms, each of which is bringing a different way of knowing, each of which is bringing a different set of priorities, each of which is bringing different values about evidence and what counts as evidence and how we weigh evidence. Imagine that in our public health classrooms. It would surely enhance the capacity of students to reason, to disagree, to deliberate, and to resolve. And it would expand the pool of students prepared for a public health workforce and with some practical skills, but also with a set of rich perspectives. Now, before we talk about what I see when I look at some of the more traditional metrics of our challenges and opportunities, I want to stop for a beat and get back to our opening music. To quote Stevie Wonder, featuring Ariana Grande, everything I see makes me have faith in you, baby. You have heard me say it more than once if you're on this faculty. We are a world-class faculty. I've made that claim based simply on the way I get excited about our work here when I compare it to the very best things that excite me at the leading schools of public health, at the top 10 places in this country. And thanks to our strategic planning partners, Gail Marsh, Tracy Boggs, Henry Zhang, and Andy Dorr, I now have the data to tell me that my radar was on target. So just to give you a sense of some of the metrics of how we compare, this slide shows us how we compare to all schools of public health, and you'll see some box plots here. So what you will see here is the dark is the 25th to the 75th percentile. The line is the median, and that red dot is us. So when it comes to articles per faculty, we're near the 75th percentile when we compare ourselves to all colleges of public health. Books for faculty, we're above the mean. Citations per faculty, we're at the very top of that 75th percentile. Grants per faculty, we're in a really nice place. Percentage of faculty with a grant, we're in a good place. And percentage of faculty with a book, we're right on the mean. Now this picture changes a little bit when we look at the top 10. And one of the things we have to keep in mind is that a lot of those top 10 schools expect faculty to raise 75, 85, 90% of their salary from grants. They have a different set of drivers, but I think it's important because I think we want to get close to the top 10. Someday in the top 10, it's important to look to see how we compare there too. So articles per faculty, we're still in the range. We have some room to go. And again, we have more teaching responsibilities than some of our competitors. Books per faculty, still in the range. Citations per faculty, still in the range, which is a little bigger. Grants per faculty, we're right on the median. And percentage of faculty with a grant, a little bit above the median. And percentage of faculty with a book, a little bit below. So I have faith that with our attention focused on some concrete scholarly and research goals, we're going to move all of those dots to the right. We're a world-class faculty. We can absolutely do it, and we will. We're on solid ground when it comes to our finances. But I'm going to make the point that we can't be complacent. We're at a point in the life of the college where it's time for us to take another big leap forward. But before I show you our finances, let me just step back for a little bit to make sure everybody understands the buckets of money that we're working with. So for those of you who have not seen the budget before, our finances, our money falls into an unrestricted pot and the restricted pot. So we have our general funds, that's made up of our tuition and fees, our share of state instruction, our indirect costs, and strategic investments from the provost. You probably heard the acronym PBA. We also have salary recovery. So when Daryl covers part of his salary on a grant, that money goes back into our unrestricted pot. This is what's going to enable the college to invest and grow, beginning to build up our reserves, our equity in that pot. We also have earnings. To date, most of that has come from the Center for Public Health Practice, and it's a really important source for funding the work of that center. We have development. So those are our endowments and current use gifts. And then we have grants and contracts. And of course, all the faculty and the students in this room know about the importance of grants and contracts. As I say, our earnings is really important for the Center for Public Health Practice. That's not a huge source of our funding, as we're going to see. Development is not a huge source of our funding yet either, but I'm not going to shrink that down because that's a place where we need to invest some time and attention and tender loving care, because it's these two pots that are going to fill back in and give us more unrestricted funds to work with. So then, this is the picture of our finances, and it's a strong picture. We have a sizable carry forward in cash, thanks to the great stewardship in past administrations, Dean Bill Martin and Dean Stan Limashaw. And you can see that over time, our sources of income have increased. We've been on a steady trajectory. Our expenses have also increased over time. And you can see here that this is most of the stuff we spend money on is salary and benefits. Most important, thanks to the efforts of our faculty and staff, the tremendous efforts of our faculty and staff, we've made critical strides forward when it comes to tuition from student credit hours and indirect costs over the past 7 to 8 years. So our student enrollment is up 50% since 2010, and this is mostly due to undergraduates. So you can see that in 2010, the vast majority of our students were graduate students, and now 40%, if I'm reading that correctly, of our students, and this is just enrollment, this is just headcount, are undergraduates. So then the big picture takeaway is we've had a nice steep rise in tuition revenue. But there's also the possibility that our revenue streams are flattening out even while our faculty FTE is increasing. So one of the things that you see here in the blue bars are the credit hours we teach and the increase in the credit hours, but also the credit hours per faculty FTE. So I worry a little bit that our student credit hours are leveling while our faculty FTE continues to increase. Here's the picture, similar picture for our indirect costs per FTE. This shows a nice increase. We're on a nice increase. But if you look at fiscal year 20, those numbers aren't up here yet. We have, Anne Florentine has been able to do projections. It's something that she does every year based on the first 6 months of data. We're looking to be roughly at the same level. So we have to be wary of leveling out here as well, because as you saw, our expenses are continuing to increase. So the big picture is we've moved swiftly in the right direction, and this is encouraging, but we need to make sure now that we don't level off because our expenses are continuing to grow. Looking at some financial projections, I think is going to help make the case for continued growth. Anne Florentine, working with Mike Papadakis' office, developed 5-year projections for general funds only. And there are a couple of assumptions. Oh, let me not forget this one. So this is our direct costs only for grants and contracts per faculty FTE compared to the US News and World Report ranked top 10 colleges, some aspirational peers, the Big Ten, and there we are at Ohio State. And it may look like we're small potatoes, but there's a big range within some of these, and we're not far from some of those and those other big buckets. So it is encouraging. So in terms of the financial projections, as I said, we're looking at general funds only. There are some assumptions that we made in doing these models. The first is there is no growth in faculty or staff. So this is what happens only accounting for an increase in inflation. So the first model assumes no growth. And what we see here is that by 2023, 2024, we begin to go into the red. If we do nothing. And this is not realistic given our overall history here. The same is true if we grow by 2%. We go into the red a little bit later, but we still go into the red. If we grow 4% annually, and of course, growth wouldn't be constant, and that's one of the things that's assumed in all of these models, except for the first, that growth is constant. We would have a comfortable level of equity, cash that we can carry forward, that we could invest in additional faculty, in students, in staff, in strategic initiatives. So this then gives some better and worst case scenarios, and these projections suffer from all the limitations of modeling. So, and I'm not going to be the person to argue the fine details of that, but my point is that growth is going to be central to our fiscal health. We have a history of growth, and we have some tremendous opportunities. We also have some challenges. And I don't want to overplay the challenges, but I don't want to downplay them either. And since I tend to be a kind of optimistic person, I'm going to start with the challenges and then end with the opportunities. So in terms of our challenges, there are the market forces that we have to think about as we move forward. So nationwide, we have seen a reduction in enrollment in the MPH program. We have to worry about the potential saturation of the BSPH market. We haven't seen that yet. Our program's been kind of elite, so I don't think it's something we have to worry about, but we have to keep our eye on these national trends. One of the things we are going to have to worry about is by 2023, remember that's the point in some of our modeling in which we're going to dip into the red if we don't put ourselves on a slightly upward trajectory again, we're going to see a decrease in the number of high school grads. That's going to affect our enrollment. And not just us, but everybody. And it's going to mean there's going to be more competition for students out there. We have to contend with the rising costs of tuition. Teresa Long shared with me a great report on workforce opportunities, so I'm one step ahead. So one of the things we don't know, and this is something that schools of public health are just discussing across the nation, as enrollment in the BS programs increases, what happens with those students? Are they getting jobs? Are they taking jobs away from MPH students? So that's something that's simply an unknown at this point. And then we also have this is the report that Teresa shared with me, the public health workforce turnover issues. So we have turnover in the public health workforce due to the inability to advance, to dissatisfaction with pay, and just overall satisfactory working conditions. So that's something for us to think about too. But right now, public health is a desirable field for students. We have to worry about social polarization. There are many families now who are questioning the value of college. Colleges are under attack for being bastions of liberal thinking. I think we are bastions of critical thinking, but that potentially affects enrollment as well. State support comes through a political process that, we have some good advocates here, but, and particularly in the provost office, but that's something that we can't control, nor can we necessarily control the research funding availability, particularly when it comes to the National Institutes of Health, the National Science Foundation. So those are some of the challenges we have to think about as we move to the future. I don't want to downplay those challenges, but I think the opportunities for us far outweigh the challenges. So here, we have an enormous opportunity when it comes to teaching. So this goes back to my points about the architecture of our programs. It's not just that we can create new programs, but we can think about degree enhancement in the things that we already have existing. So our distance learning courses and programs, that's a tremendous opportunity nationally. That's where all of the schools of public health are looking to grow. Certificate programs, minor programs, general education courses where we can collaborate with partners from other colleges. You already heard me talk about the potential for replicating the BSPH model with a new set of partners. And of course, we have the opportunity to increase enrollment in the BSPH program and existing joint degrees and new joint degrees. We've got a lot of joint degrees. We can increase the foot traffic over those bridges. Grants. We will, at the end of strategic planning, have a new division in faculty incentive plan. We will have a new approach to mentorship and proposal writing and support for that in the Office of Research. We will have new division chairs that are going to bring new ideas, new sources of funding. And while there's a negative side of the workforce picture right now, there's also a positive side. Our students are already workforce ready, or at least workforce readiness oriented. So that gives us an advantage. And at least 23% of the public health workforce in the state of Ohio is planning on retiring by 2023. So there are job opportunities for our students that are going to continue to make a public health degree remain attractive. So how we act on and align these opportunities with our existing strengths and commitments will be the work of strategic planning. We're going to formally launch that on March 3rd when our strategic planning steering committee meets for the first time. There is a strategic planning core committee that's been meeting for several months now, but this is the moment in time in which we're prepared to launch the whole school. And I'd like to take this opportunity to introduce you to that committee. We are committed to ensuring that you all have an opportunity to actively participate. So stay tuned. You're going to find regular updates in the faculty and staff newsletter, in the student newsletter, and on our college website. That said, we cannot wait for this summer, when strategic planning concludes, to move the College of Public Health forward. Every day, we need to be making progress on those items that we know align with our values, that we know align with the university's strategic plan, and that will advance the college and advance the whole. One of those opportunities that I have not yet discussed is advancement. And this is a place where I've been spending a significant amount of my time meeting with some of our key alumni and with some of our donors. I'm giving you a sense of some of the priorities we've set. There's going to be more opportunity here. And I can come back to this in questions and answers. But the thing I want to highlight now is the Ruth Ella Moore Scholarship, because today is the formal launch of fundraising for the Ruth Ella Moore Scholarship Fund. This scholarship prioritizes first-generation college students, and it's going to be the focus of our day of giving for the college. Ruth Ella Moore was a Columbus native. She was the first African-American woman to receive a PhD in the natural sciences in bacteriology in 1933. Not only the first at Ohio State, but the first in the nation. From the preteens to the 1940s, bacteriology was the core science of public health. The history of bacteriology is central to much of my work, and so it's very dear to my heart for that reason. But bacteriology and Ruth Ella Moore also provide a concrete connection between public health and the arts and sciences. So that makes it very special to my historian's heart, too. Strengthening that tie has been an important theme in the history of public health since at least 1916. And you can trust me on that. I'm not making it up. I can give you things to read. So this scholarship is central to my vision for inclusive excellence. It's so central, in fact, that I gave the lead gift. And I did this for a number of reasons. I've never given to my prior institutions. I always felt a little cynical as a faculty member when I was asked to give. But what's changed for me is that I have enough faith in us to give a percentage of my salary annually. This place is worth it to me. The faculty are worth it to me. The students are worth it to me. The staff are worth it to me. Our partners are worth it to me. The Ohio State University is worth it to me. The Ruth Ella Moore Scholarship provides us with an opportunity to make a concrete commitment to the university's strategic planning effort by addressing access, affordability, and excellence in a meaningful way. So let's talk a little bit about diversity now. We have been, for accreditation purposes, using the demographics of the state of Ohio as our yardstick for accreditation. Although we do well on this front when compared to the university as a whole, for a College of Public Health, this bar is simply not high enough. We need to be using, at the very least, the city of Columbus as our yardstick. And we do quite well here when it comes to our undergraduate students. So what you're going to see here, you probably can't read it, is the blue is Columbus, the green is Ohio, the red is OSU, and the gray are going to be our BS-PH students, and the black are graduate students. So you can see there, we don't come close to the demographics of Columbus when it comes to Black or African American students. We do well with Asian students. We do reasonably well with students who are of two or more races, similar to Hispanic students. Those are our figures for white students, for students whose race or ethnicity is unknown, and for international students. We also need a yardstick that takes into account social class, and geography. So here we're looking at the first-gen students. And on the undergrad front, we do well. So we're at least matching the university here. And I don't know what target we should have. Perhaps there's a way to figure out what percentage of students who graduate from high school in Columbus could be first-gen students. And that's something we can probably try to dig into maybe in strategic planning. But we don't do well when it comes to our graduate students. So this is a place where we must do better. We have an opportunity here to really own our status as a land-grant university. And not just a land-grant, but an urban land-grant university. And a land-grant university in a state with many rural communities where higher education may simply seem out of reach for a significant proportion of young people and their families. The Ruth Ella Moore Scholarship, once the endowment is complete, will cut across some of those categories that divide us as a society. A first-generation focused scholarship can open the door to higher education for those who face significant obstacles, including underrepresented African Americans and those who've grown up in resource-poor Appalachian counties who might one day take the skills they learn here back to their communities to lift them up. Every one of us benefits when we seek out those voices that are missing and when we listen. And it's clear we need to be making this effort not only with our students, but also with our faculty and staff if we truly want prospective students to see themselves at this college. So what you see here is the demographics of Franklin County and OSU as a whole. And the gray bar is going to be our faculty and staff combined at the College of Public Health. And here you can see that except for Asian employees, we missed the mark on many fronts. So we have work to do here, and we can and will do it. So I want to end by coming back to the importance of developing our voice and the grand opportunities that it presents. I'm not going to put up our vision statement. There's nothing objectionable about it. But like our mission statement, it does nothing to distinguish us. So I want you to think about Boston University. Think, teach, do. Think about Harvard, protecting health, saving lives, millions at a time. I'm going to wager that a lot of us in here say, oh yeah, I knew those things. And those aren't just brilliant marketing taglines. Those are statements of vision and core purpose. A vision is not a mission. It's an aspirational call to action. It should be just out of reach. It should be a little bit scary. It should represent a mark that we might miss. My vision goes beyond what we're going to ever be able to put on our college webpage, because I'm going to go on and on just a little bit right now. But my vision is that our collective college voice must be distinctive, and our collective college voice must be heard. We can be more than just another voice in this field. We can set ourselves apart from other schools of public health around the nation. On the one hand, this is going to mean I put a big premium on the work of Misty Crane and her team. They're going to be key to getting our voice out there. But marketing and communications is not the only solution here. Developing our voice means embracing the strategic planning process to identify those signature areas where we can and should invest as a college. And we have to do this in a way that's true to our commitment, not just in intervening in populations after they've been dealt a bad hand, but to changing the rules of the game. And here's where we might want to think in more topical ways and not some of those big themes I laid out earlier. I want all of you to be a part of this conversation, and so I urge you to fill out a strategic planning survey that you're going to be getting in the mail tomorrow, because each of our voices is integral to this effort, both individually and as part of the College of Public Health community. Whether we're talking about our individual voices or the collective chorus around some central commitments or signature topics, there are some hallmarks I want to see. I want our collective voice to be confident, built on academic excellence and research triumphs. A voice that enters into local, national, and state and international discourse on pressing public health issues in a meaningful, memorable way. I want our voice to be provocative and probing, one that's unafraid to be bold. I want our voice to be empathetic and open, a voice as likely to ask the right questions as it is to offer its own opinions. Our capacity to listen with respect and a kind of bubbling curiosity to each other, to our students, to our partners, to the communities that we serve, must rival our capacity to share our insights and our analyses. And I want us to remember that voice is about how an individual audience receives the message. Our voice should inspire trust. It should be welcoming, quick with an invitation to people of all perspectives and life experiences to join the table. In developing our voice, we each have a role. It starts by supporting a culture of showing up and speaking up. And here I want to thank the faculty and staff who took the time to join us today. I'm really pleased that you're here. And this is precisely what's going to allow us to thrive. But we have other opportunities. For instance, at least once a semester, we're going to start having one signature college event. So on March 5th, we have the authors of Sexual Citizens, a landmark study in college sexual assault, who are going to be here. We have with partners in social work, in advance, many other units in the arts and sciences, many other units around the college. The Office of Institutional Equity, for example. I'm going to be leaving people out. This is why I shouldn't ad-lib. We're going to have the opportunity to reframe this conversation as a public health conversation, rather than as a problem that we're trying to treat one sexual encounter at a time. We need to be thinking of it as a public health problem. We have the HOPES lecture series with its focus on social determinants of health this year. And the last lecture you had was standing room only. And I would like to see that happen again and again and again, because that's clearly one of our signatures. And attending these things isn't just about coming out to support the college or to support our colleagues. So that's very nice, but making us visible, making us heard to the other people who are in the room, both partners within the university and those stakeholders from outside who are coming in for those conversations as well. Whatever the venue, there is one thing that we can count on. If we don't show up, we will not be heard. So show up, speak up, be heard. Now, before opening up for questions and comments, I'd like to end the State of the College address, my first, by starting a new tradition. Many of you know that I came here by way of Texas A&M, and at Texas A&M, there was a tradition that really moved me. So each college had its own coin minted, and it reflected its values and commitments. And the coin was a way for the dean to recognize alumni, donors, friends, faculty, staff, students, community champions, community partners, whose work was outstanding and merited some attention. The first time I spoke to you as dean, I said I wasn't going to try to call out everybody who had done something extraordinary each and every time. Now, this is the state of the college, so I did a little bit more of that than usual, but my intent there was to show you what the themes I was seeing. But now I want to call somebody out because, and it's only going to be one person, and I recognize we have so many people here who are extraordinary, but it is important sometimes to recognize just one person. And one of the programs I have not yet called out today is our Masters of Health Administration program. It is truly one of the jewels in our crown. It's ranked 7th nationally, and people like Julie Robbins have heard me say 7th, number 1. At that point, you're talking about such subtle differences that it doesn't matter. And the students in that program are amongst our most engaged. So there are many faculty and staff who deserve credit for this program. But over the past year, Dr. Julie Robbins has not only devoted an enormous amount of love and devotion to the program and its students, she's done so during a period of college transition when we didn't have communications, we didn't have development, didn't have a dean for part of it. Well, you had a dean, but we were handing off deans. And you were trying to celebrate that program's 50th anniversary. So then it seems only fitting to me that Julie, who has done so much to maintain the distinctive voice in our college, should be the first recipient of the College of Public Health coin. So Julie, thank you. Yeah, so and I'll show you how to you have to hand this off with a handshake. A handshake, there you go.
Well, thank you.
Oh.
Thank you so much.
Thank you, I really appreciate it. All right, so, yeah, no speech. We're on a strict timeline here. All right, so I would like to open us up for questions and comments. And somebody will kind of give me the hook when we think I need to close this out. All right, so questions, comments. Mics are being brought up. If you'd like to come stand right next to me and speak into my lapel mic, you may do that too. Can you come to the mic, please? Because they're recording it.
Since the purpose of the College of Public Health is to work for the common good, why do you have label something marketing? The purpose of marketing is making a profit.
What have I labeled marketing?
Didn't you thank someone for heading the marketing?
Well, we do
division?
have a marketing. So Misty Crane is our Director of Strategic Marketing and Communications.
Right, couldn't you call it something that would, instead of focusing on profit, would talk about the common good? That is my comment.
So I'm going to wager, and you can tell me if I'm wrong, I said the word marketing once and the word common good, shared fate, common well-being many times. I'm not worried about that.
Okay.
Thank you, Judy. You know what, students? I really love it when students come in and ask questions. Did you hear what I said at the beginning about the importance of, and one of the ways you do that is to step up to the mic, even though that might be happening. Corey.
Hi, so I'm a finance person, so I'm going to ask a clarifying question.
Okay, I hope I can answer it.
I think you can. Can you just explain what you meant with the chart about if our costs, so are you saying that we'll be at a loss?
Yes.
If we just keep doing what we're doing?
If we keep doing what we're doing, we don't grow our faculty or staff just because of inflation.
Because our expenses will just grow.
That's right, our expenses are going to grow, and the money we have for strategic initiatives is going to become money to operate the college.
So then,
and it eventually runs out. Did I get that right?
You did.
All right.
You definitely
Thank you.
I thought that's what you were saying. I just wanted to make sure.
So you all have to know that whenever I walk through the student area and the MHA students are there, I say, "What are you working on?" They always say, "Finance." No, but they don't. They say finance. But so go ahead.
Well, I wasn't trying to quiz you then. I promise.
All right. Thank you.
So then, could you be a little bit more? Could you provide more insight into kind of where you think our opportunities are to grow the general fund in terms of which part? Is it, do you anticipate course credit hours? Are you trying to grow grants more?
So I think grants is one of them, and I think not just covering our salary with grants, but grants collaborative research that is going to have a higher chance of hitting with some of the big funds with NIH, with National Science Foundation. That's an opportunity. So we need to look at our incentive plan to make sure that we're incentivizing the right kind of grant. But certainly the other opportunity is tuition. So if you look at our student credit hours, we have more student credit hours from graduate programs than undergraduate programs. Now I recognize we've had an elite undergraduate program. And my goal here is not to say, let's open up the floodgates. We can still be elite, but we have our kind of an inverse pyramid where our graduate funds our graduate tuition is the most important. We need to flip that onto an undergraduate base. So we need to take advantage of those opportunities to grow the program. And if we do it in ways that are strategic, we can enhance programs that are going to be looking for some credits because of losses in the general education curriculum. Yes. All right, Zane.
Hi, I've met you once before, and it was actually when I saw the newsletter saying, "Hey, Zane, you made it on the dean's list." And I was like, yes, of course. I knew this would come, and I wanted to thank you. I wanted to thank you for when I walked to your office, in that email it said you could visit the dean, and welcome me with open arms and taking that picture that I really didn't want to take because, I don't know, for those of you who saw the picture, I don't know, it could be considered inappropriate. I had a very posh jacket with Jesus and his Mother Mary on it. So it graced the front of the page. But I wanted to thank you for an uplifting message, because my time here at OSU, I'm now leaving this spring, hopefully. And I've had time to work as a researcher. I went on the policy field trip last year, and I got to be a lobbyist. And I think that you talking about the diversity, the goals that we have to hit, that's very uplifting in a time of social and political polarization and fragmentation. And it makes me feel inspired to go forward confidently, because as you said, and perhaps maybe a little confusion about the marketing plans and et cetera, my favorite Oscar Wilde quote is, "A cynic can name the price of everything, but not the value of anything worthwhile." And I think you valuing our diversity and the things that can hold us together and the potential that we have makes me feel that I picked the right place to invest my time and my future. Thank you.
Thank you, Zane. I kind of think I ought to end it there. But so let me just say one thing about your shirt. So it's not what you wear, it's how you wear it. And that's what I always tell people. So your professionalism is about how you comport yourself, not how you look. So I appreciate you taking the picture, and I appreciate you standing up to Mike. Zeb. Sorry.
My question is what are your goals around incorporating the alumni societies into the vision of the college?
Well, the incorporating alumni societies into the vision of our college, the MHA Alumni Society, well, I guess it's the HSMP Alumni Society. I think of it as the MHA Alumni Society because that's who populates that society. Really sets a gold standard for us as a college. And I recognize that the MHA program is a small cohort. They move through that program lockstep. They get to know each other very well. They get to know faculty very well. But with your help, we can begin to create the same community spirit within the College of Public Health Alumni Society. So we need to meet more as part of strategic planning. We need to get you engaged as part of strategic planning in thinking about our development goals as well.
Okay.
Thank you.
Thank you.
Yes, 2 students. You just made my day.
Yes. So this is kind of going off of what you previously had mentioned. I feel like, and this has been a common thought, that diversity and inclusion has become an unfortunate buzzword among communities at this university, and not only here, but overall. So it's one thing to have diversity on the surface level in terms of numbers and representation, but it's another thing to have the resources and the support system to back up those students and faculty once they get here. So I know you've been working with the scholarship, but beyond that, like deeper levels once students arrive here and even now, could you talk about maybe if you're planning on that?
So how do we support student success? So I think there are 2 ways. I think one, we do it through a kind of classroom structure that goes beyond the surface and that allows students to interact and disagree. And again, I'm going to call out Mike Bessesi here because our integrated structure that helps. But every faculty member I've talked to here is invested in active learning. I'm really impressed with that, and that's going to be the way in the classroom we do that. One of the initiatives, it's not quite ready to launch, but Amy Furkatich and the diversity committee has been pushing for this. We'll announce it soon. Hope you won't throw anything at me. But working on a support program for first generation students and underrepresented students. Are we limiting to first gen?
Well, you asked the chair of the co-chair.
The initial one is first gen.
The initial one is first gen. So and I think I would like to use the phrase inclusive excellence, because I do think when we say diversity and inclusion, it kind of falls on the ear in stale ways. I mean, it shouldn't, but it does. But I think that's what we want to talk about is inclusive excellence, and that means inclusion in the thinking that goes on in the classroom, inclusion in the life of the college. And here too is where I think we can go back to Zeb's point and think about the role that the alumni societies can play in this effort as well, because you all are going to have a first gen panel coming up pretty soon, right? So, thank you.
Good afternoon, everybody. My name is Rachel Ramirez, and I was a student, one of those dual degree students in my MSW MPH in 2007. Yes. Ended up finishing my MSW and didn't quite finish my MPH because I got my dream job at the Ohio Domestic Violence Network. And I am Dr. Juliana Nimitz, a research partner from the Ohio Domestic Violence Network, doing really game-changing work around issues related to domestic violence and brain injury. And the partnership between the research world and the College of Public Health. The first time I worked for the statewide coalition on domestic violence, we work with all 72 domestic violence member programs across the state, have never been a part of a research initiative like this. And the research supporting the practice and the practice supporting the research has turned what could have been one of those 3-year grants that you get and you make some brochures and it's good, and then you move on to the next grant that you get, into really game-changing work, doing national and international work around stuff that we didn't even know that we didn't know. So I just would like to very much, it's good to be back here many years later in a different role and in a different shape, but just that having that partnership and that big picture ability and the support of people who actually know how to do needs assessments and those kind of things has just really changed the game, not only for domestic violence services in Ohio, but for domestic violence services across the country. So thank you for your work, thank you for recognizing it, and thank you for the incredible support and the opportunities that we now have because of the connection with Ohio State.
Well, thank you. And I think that's a prime example of exactly the kinds of robust, meaningful community connections we need to be making and that we need to really incentivize and foster and support within the College of Public Health. It's one of the reasons I highlighted Juliana's work. It's a stellar example of that. And if you haven't joined the Alumni Society, let me introduce you to Zeb and Robert Hood, so we could use you to continue to partner with us in other ways. Yes, come up to the mic, please.
Thank you, Dean, for a wonderful presentation. You have a lot of energy, I want to tell you that, and we appreciate that.
I have a lot of what?
A lot of energy.
Okay.
Yeah, it seems like it. Okay, my name is Dr. John Ejezi, actually. My question is, it goes with doing like virtual classes. Okay, we live in the internet era where people can join their classes from anywhere in the world. And I know you were looking at the numbers too, which makes a lot of us, look like, okay, yeah, she's looking at the numbers, our bottom line here. So that kind of works out too. And looks like everything is looking good. Although sometimes in public health, it's hard to put your achievements and how much impact you've made, especially if you've made solid social change into quantifiable numbers. Sometimes you can't just quantify what you do, because what you do could impact lives, just like public health, preventive health. Some people don't know how much they didn't go to hospital because of what you've been doing. And that's why sometimes public health can be underrated. When people are not sick, they're like, well, I didn't get sick anyway. Well, you didn't get sick because you was prevented. So, with that said, I'm looking at us, how do we get into the virtual, classroom where we can have more virtual classes, we make more money, we have more students join the program, we have more ambassadors all over the world. And I tell you something, I teach virtual classes, I'm an epidemiologist, but I could tell you, something I've learned over the years teaching those classes. Sometimes you have students from all over. I was in Nigeria for a health mission, just came back on Sunday. I met one of my students when I was in Nigeria, because he said, if you're coming to Nigeria, I'll come to the program. And when I showed up, he was there. He joined us in the help. So virtual classes, you can have ambassadors all over the world, and Ohio State is a big name. We are Buckeyes. Okay, and if we can incorporate that, that would be something, I mean, I think will take us to even a greater height. Thank you.
Oh, thank you, thank you. So that's an excellent point. And the great news is we have 2 programs that we are very close to being able to get to put fully online. Our PEP program, that's one of our priorities, our Masters of Public Health for experienced professionals. And also the joint program that we have with the veterinary medicine, both their master's degree and their DMV. That's one of our strongest programs. We are very close to having that ready to go online. We have hired for Margaret Murphy. We have another, we have another a half FTE person. Is she here? Yay! Who is going to help us precisely with this issue? But there's unquestionably a space. We don't need strategic planning to know we need to move into that space. So we're starting it already, and I thank you for bringing it out. And I think too it gives us opportunities to think about how we teach. So I don't know if Rebecca's here. Is Rebecca Andrews here? All right, but she's always here, so she's a good citizen. So I count her as somebody who always shows up. But one of the things Rebecca has talked about is how going in to teach online made her rethink her teaching, because the online setting is very different from the face-to-face setting. And what she learned going to teach online is that she had to find different ways to engage students, to keep them engaged, to interact with them, and that's gone back to change the way she teaches face-to-face. So there are pedagogical reasons, too, for beginning to move into this space, because it forces us to rethink our teaching and rethink our approaches, engage with students more, and that's one of the big strategic goals, not only of the college, but of the university. Okay, so I'm getting the hook here. What I would like to do, we started with a little music, a little Stevie Wonder, and I'd like to send you out with some Aretha Franklin. I hope, as we seek those ways to strengthen our college voice, that this song is going to speak for itself.